Good Monday to you. Welcome back to Open Line. If you are just joining us on this Monday, welcome. We are glad you are here. Tonight we are talking about mental health, especially after this past year that we all have endured. And 2021 did not start off much easier for any of us. So thank you for being here. And if you are looking for resources for help, we have them tonight. There's some good news for you. And also feel free to call in and share your experience, or if you have any questions for our experts, I know they can answer them. The number you can call tonight is 615-737-PLUS. Also, get a pen and paper ready, because we're going to give you a phone number to call, a text line that you can use, or also a website to find some screening tools. So get that paper and pen ready, and we will show that to you in just a couple of minutes. I'd like to welcome back our guests now, Tom Starling and Jackie Cavnar with Mental Health America of the Mid-South. Thank you both for being here. I want to talk again about these screening tools, because as soon as we mentioned them, a lot of people called in kind of behind the scenes and said, okay, tell me where to find it. So obviously we have struck a nerve. Tom, could you rattle off again if people are saying, am I just sad, or do I have depression, or my heart's racing and I'm worried about these things, but is that anxiety? I don't know. Or maybe I have PTSD. Tell me more about these screenings.
And that's the thing. We're asked those questions all the time. People come up to me and say, I have these symptoms. I'm like you, Carrie. I'm like everybody watching. I'm not a therapist. What I do is help take the guesswork out of this. And that's where I direct people to those screenings. And so they can go to those screenings and I would always suggest taking 2 or 3 of them. Look at the ones that are on there, the ones that maybe pertain to you, send them to a friend. And the questions on there really are you angry or irritable more than usual? Do you dislike doing some of the hobbies and things you used to like to do? Has there been a change in your eating habits or in your exercise? And, those types of questions, people say, well, anyone could say yes to that. And that's where I really validate that statistic that says 1 in 5 people annually have a diagnosable mental illness. That's not schizophrenia or bipolar. That's from a divorce or a lost job or that troubled child or your aging parent. And that's why we all need to have a mental health checkup now and then. So there really is no health without mental health.
I think that as we grow older, perhaps we realize that life is not linear. There are definitely peaks and valleys, and hopefully you don't stay in one of those too long. And Jackie, I think that it is also important that we point out that these screenings are not only meant for you, but if you have questions about maybe what your child is going through.
Carrie, you're correct. We do have a screening for parents to take if they're worried or concerned about their children and some of the behavior their children are exhibiting. And we also have a youth test for young people aged 11 to 17 who may be concerned about their emotions, or if they're having any significant problems. They may take that and share it with their parent if they feel open enough to do that. And then you could print those off and take them to a visit with your pediatrician or a family physician if that's who your family chooses to see.
I think it's worth mentioning that these screenings are anonymous. You won't be contacted afterwards or hounded in any way or sent flyers to your mailbox, right?
Correct. They are free, they are confidential, and we do not get any of the contact information from those. It's perfectly anonymous.
But Tom, what does the person who is taking those screenings get after they complete the questionnaire?
Yeah, it's wonderful. In classrooms, 100% of the time, somebody comes up after class and tells me, hey, my parents don't believe in what's going on. I can't get the help I need. Somebody always says that. And I'm like, okay, go take a screening. And after you take those screenings, you can find prescription discount cards. You can find a crisis text line. You can find, helpful do-it-yourself protocols, some DIY exercises. And of course, most of those exercises are join a group, join a meetup, share with somebody, because the biggest mental health protective factor that we have is connectedness. And right now we're not connecting very well. And with this, we don't connect very well. But, whether it's an online support group, a pet, your faith community, your friends, your teacher, there's some DIY protocols on there that are kind of the first steps in helping you to connect and build up your resiliency and your mental fortitude, as well as where to make an appointment, where to find those support groups, how to access services with or without payment, with or without insurance. And I tell you, those online resources are really good. And I think that we just updated those, so they should be pretty fresh.
Oh, that's fantastic. One thing, mental health can cover a lot of different things, but there are certain things that are not mental illnesses, and this is worth pointing out tonight, Tom.
Oh, I'm so glad that you mentioned that. I really have had a lot of people talk to me about the violence they've seen at protests or violence they've heard about with mental illness. And really, people with a mental illness are really no more violent than anybody else. In fact, people with a mental illness are 4 times more likely to be a victim of violent crime. So when you talk about terrorism, hate, domestic violence, that's not a mental illness. That's not schizophrenia. The terrorists who ran into the Twin Towers, that was not bipolar. I mean, there are there is a different reality sometimes. There is depression, which is almost like working underwater, just in slow motion. There's anxiety and some different things that we have. But yeah, I think that's really important during these days. We need to limit our Facebook, limit where we get the news, kind of unplug ourselves, find some hobbies, puzzles, and really get away from some of what we're seeing that might be upsetting us, because that will end up affecting your sleep, your mood, your eating. But I do think that that's important to say that hate is not a mental illness.
No, that's something we definitely need to recognize. I'm glad we talked about that. Let's go back to the lines here. We have Mickey on the line. Mickey, thank you for being part of the show today. Go ahead.
I'd like to know about a new drug for bipolars. I'm bipolar too.
All right, Mickey, thank you very much. I'm gonna hang up so you can listen to your TV now. Now, Tom and Jackie, I know you guys are not psychologists or psychiatrists who would be prescribing medicine. But for people who have questions about, is this the right medicine I should be on? Would a screening tool, or I guess I'll just leave it open-ended, what route should they take?
I think that when it comes to medication management and being on the right medicine, we really believe in medication access. That's something that we advocate for down at Legislative Plaza in Cordell Hull. I know that a lot of people believe in step therapy. Let's start with what works for a lot of people, but not everyone. And then we'll try another. And then only then can you get to the medication that you and your doctor knows would work for you. And we don't like that step therapy. We really believe that physicians should work good with their patients and try to find that best medicine that works. And sometimes I know that there's different hoops we have to go through based on where you get your care or what your insurance is. And so we are out there advocating for people who have these disorders that need the right medication at the right time. But only an MD and maybe a psychiatric nurse, but really it's an MD that's going to be prescribing those medications. So be sure that if you do see a therapist, if you do go see a licensed professional, that maybe they at least have that relationship with a doctor who could prescribe the right medications.
Good advice. You mentioned advocating and pushing in a legislative agenda, so to speak. The session is just starting back up here on our Capitol Hill. Anything that you're focused on for this session?
We are. We're really big on what we call parity. That is, we want mental health to be on par with physical health. We want it to be very equal. We shouldn't be saying we're limiting your mental health to 10 visits to a psychiatrist. We would never limit your primary care visits. We want that freedom that your primary care physician has to prescribe medications. We want those same levels to be for mental health. So I would think that parity is really going to be one of the biggest ones that we're fighting for this time around, as well as what we call ACEs, adverse childhood experiences. We really want to help children, just knowing that the trauma that they have and that they experience can really impact them down the road. And so we're going to be working for children's mental health as well this session.
The governor has passed some legislation, and even if I can remember all the way back to his State of the State address, which seemed like forever ago, and he talked a lot about this and putting money towards getting more counselors into schools and really funding an ACEs program. Are you seeing that happen and come to fruition, or is there still a lot to do?
I'm seeing it. I think that, Tennessee, Mental Health America nationally just released a big white paper on the state of mental health across our nation. And Tennessee moved up from 39th to 28th.
Wow.
And that's a great movement. Yeah. And we still have to work on some affordability and some accessibility, but I really see that. Jackie, I know you work a lot with that public policy and legislative too. You're seeing that, aren't you?
Yes, definitely, for sure. Governor Lee has been a great advocate for mental health and putting resources where they need to be, and entrusting Commissioner Marie Williams, who is over the Department of Mental Health and Substance Abuse Services. She is such a great advocate and a great partner with all of the providers and the clinics and the organizations similar to ours who are connecting and providing care for the underserved every day. She's a real asset to this state.
One thing that just popped in my mind that we have mentioned on the news a few different times, first when it came to teachers, that there was a specific hotline set up for teachers who were just really needing some place to just vent, talk, work through some things, because so much has been placed on their shoulders. And then after the bombing on Christmas Day, the same hotline, and I don't know if you guys are connected to it or helping supply resources or have heard from folks in those two genres yourselves, but these are two areas that have really just hit close to home to our own communities lately.
They have, and Carrie, we do have a workplace wellness program that is separate from the screenings. And we have a school-based K through 12 program where we go out and visit schools and talk to the children age appropriately, of course, and do a program with Icy Hope, who is our duck mascot. And we have morphed some of that material into more of an adult version and using it for train the trainer sessions for a lot of the school systems in and around Middle Tennessee. And it's really taken off. And I know we've done it for DeKalb County, I believe Sumner County and Murray County, a little bit in Davidson County. But we are more than happy for professional in-service days for our staff person who has her doctorate to go in and to do those sessions and lead that for faculty and staff so that they'll have tools for themselves as well as tools for their students.
That's so very important. That's encouraging to hear. When you have people that take those screenings or call in or join a group, do you tend to hear the same things from people, like, I didn't know this was available, or I thought this was going to be a harder road to get help, or things like that? What are the common things that you hear?
For me, it's, you've been around for 75 years. We didn't know that. but I think a lot of people know our programs but don't know our name. Some even remember us back when we were Mental Health Association, which was not too long ago. But yeah, sometimes it's almost like there's a sudden death in your family and you need a funeral home and you have no idea what funeral home to use. Similarly, I think that some people wait and suffer in silence until there's almost a chronic physical illness along with their mental health. And they think, well, I need to look up. I need to find this place. And so people are pleasantly surprised when they're able to find us online or call us, and especially with the resources we have that can help them navigate a very confusing system. So we're always glad to help people discern what's the difference between a social worker and a counselor. What's the difference between these medications? Where do I go if I don't have insurance? And people are very happy to hear about that. And sometimes it's just as easy for them to pick up 211 and for them to be directed to us that way.
That's fantastic. Okay, we're going to give out the numbers that we mentioned at the beginning of this segment, and we will give them out again if you don't catch them all, so don't worry about that. And then we're going to take a quick commercial break. So Taylor, if we can show those numbers as we go to break, hopefully. You can text TN to 741-741. That is one way that you can get help. TN to 741-741. Also, if you would like to just make a phone call, you can do that 24/7 to 800-273-8255. And if you would like to take one of these screenings that we've been telling you about, here's the website, MHATN. Actually, let me check that one. We'll stay with that one for right now, MHATN.org or MHAMidsouth.org. We'll figure that one out during the break and get right back to you. Stay with us.